Hello everyone, this is Dr. Sharmishta from Nanjapur Hospital. In this video, I am going to address on the topic tobacco and its deleterious effect on oral health. India is the second highest tobacco consumer in the world. About 230,000 people die every year due to consumption of smokeless tobacco. The most prevalent form of tobacco used in India is smokeless tobacco, and the commonly used smoking forms of tobacco are bidi, cigarette, snuff and hookah. Tobacco contains the highly addictive psychoactive ingredient called nicotine. Tobacco is highly addictive because of presence of nicotine. However, it's the thousands of chemicals in it which makes tobacco use so deadly. Chewing tobacco contains at least 28 cancer-causing agents or chemicals which are medically known as carcinogens. Users of snuff and chewing tobacco are at a higher risk of developing cancer, certain type of cancer, most notably cancer of oral cavity. The common site are lip, tongue, cheek, roof and floor of the mouth. Your body plays a key role in maintaining the rest of your body healthy by protecting it against food-borne bacteria. So let's see what are the common side effects of tobacco on the oral cavity. The first and foremost is tobacco stains, the brown or black discoloration seen on the teeth. It reduces one's self-confidence while having face-to-face interaction. Bad breath, medically known as halitosis. Then it can destroy your gum tissue or irritate the gum tissue. Abrasion of the teeth, which again eventually leads to sensitivity of the teeth. Gum recession, where the root surface of the teeth is exposed, gradually leading to the hypersensitivity of the teeth. Food lodgement, bone loss. As bone loss occurs, there is food lodgement because of the gap between the teeth. As gap between the teeth occurs, there is proximal caries, which if left untreated can lead to grossly carious tooth, which needs root canal treatment or at last extraction. There are complications seen in gum surgery or after tooth extraction, such as delayed wound healing or dry socket. It's one of the painful condition where the healing doesn't take place, bad breath is there and patient can't eat food properly. Tobacco users are at a higher risk of developing ANUG, that is acute necrotizing ulcerative gingivitis. This is again a very painful condition in which we can see swollen gums, bleeding gums, pus oozing out from gums, loose teeth, bone loss and terrible smell and breath. Smoker's melanosis. In this condition, we can see brown or blackish pigmentation in the oral cavity. Buds and keratotic patches. The common site is lips. It's seen in people who are habitual smokers. Hairy tongue. The dark black furry appearance on the tongue. This condition is reversible if you eliminate the contributing factor and adopt for good oral hygiene. Smoker's palate. Smoker's palate is a condition seen in people who are habitual cigarette smokers who use cigar frequently. In this condition, you can see irritation or inflamed roof of the mouth. Smokeless tobacco keratosis. This is a condition which we can see commonly people who use chewing tobacco, moist snuff, dry snuff. The common oral symptoms are mucosal discoloration, where grey and white patches are seen with wrinkled or fissured appearance. High rate of leukoplakia, erythroplakia. These are the precancerous lesions seen commonly in the site where people keep chew or dip. This is the precancerous lesions where the oral symptoms are grey-white patches which does not heal. This precancerous lesions can lead to oral cancer if neglected and with continuous use of tobacco. Stopping tobacco products can heal the spots. However, treatment is needed if there are any early signs of cancer. According to the Oral Cancer Foundation, smoking is the prevalent significant factor in majority cases of oral cancer that are detected every year. Oral cancer is a lifestyle disease which can be prevented by kicking the habit and adopting a good oral hygiene. So in this video, I would like to highlight some of the early warning signs of oral cancer. A swelling, lump or growth in the oral cavity which does not heal. Red or white patches that does not go away. Pain while swallowing. Multiple painful ulcers which does not go away even after consuming basic medications. Pain while swallowing, restricted mouth opening, burning sensation in the mouth, a nagging cough or persistent hoarseness, extreme weight loss, sudden mobility of the teeth or loosening of teeth with no apparent lesion. So these are some of the basic warning signs of oral cancer where you need to visit your dentist and get thorough checkup. There are innumerable side effects of using tobacco or smoking or using any of the tobacco products which can't be covered in one video. It's better to stop these tobacco products and lead a healthy life. So what are some of the good reasons to stop chewing tobacco or smoking cigarette? There are myriad of good reasons to stop smoking or chewing tobacco, which includes health and financial benefits, which can save life and money. Tobacco harms nearly every organ of the body. If you want to live a healthy lifestyle, if you want to live a healthy life, you need to stop these habits. Smoking is leading cause of preventable death. Secondhand smoke can harm the life of your loved ones and your family. A healthy mouth with pearly white teeth and fresh breath boosts one's self-confidence. This is for all the people who love their family. Please stop smoking cigarette or using any of the tobacco products. If a person is serious regarding quitting the habit, they may seek help from professional healthcare professionals, therapists and counselors. Try to figure out the triggering factors that makes you use of tobacco products such as stress, anxiety, depression. There are many ways you can cope up from this, such as yoga, meditation, or develop any hobby such as swimming, cooking, whatever you like, so that you don't feel like using any of the tobacco product. Try to avoid the company of people who instigate you to use tobacco products. There are nicotine patches available in the drugstore. If there is a severe urge to use the tobacco products, you can use the alternatives such as sugar-free chewing gums, nicotine gums, which can give you the effect of having chewing tobacco or smoking a cigarette. Then you can use dry gooseberries, which are available in the market, which is loaded with vitamin C, which is good for your healthy gums as well as healthy skin. There is an adage, bad habit dies hard. Nothing is impossible. The word itself says I am possible. So try to avoid tobacco products as much as possible. For any further queries, we are here at Nanjappa Hospital. We will be glad to help out. Thank you.